fellow chiropractors, unleashers of the imprisoned impulse, slayers of subluxation. I'm Dr. Anthony Pellegrino from ChiroEdge, and welcome to this week's episode of the Chiropractic Research Breakdown. Now, I'm not going to lie to you, we're taking a little bit of a different approach this week because some of the articles that we're going to talk about really piss me off. We're going to talk about the difference between manipulation and adjustment and why you should care. I'm also going to give you guys a personal story about why I think research is important. Hang in till the end, stay part of this episode because I think it's really important to both hear the good and the bad in terms of research, in terms of science, and know how to critically evaluate and think about research instead of just accepting what's put in front of us. Instead of just repeating and playing a game of telephone, we repeat the wrong information, repeat the wrong information, repeat the wrong information, repeat the wrong information, repeat the wrong information. Anyway, let's go ahead and jump right in. So for some of you guys who don't know, I actually practice. I have my own practice in New Jersey, in Monmouth County, New Jersey. If you guys know the show, The Jersey Shore, where I actually practice about 20 minutes from where that took place. 20 minutes north, totally different area. Don't judge me. Yes, some of the people I see are like that, but not the majority. What many people don't realize about this area right here is a lot of, more affluent areas of the country, which this happens to be. There's a good deal of skepticism, a more, aware consumer. I don't know, maybe that's just me saying that. You might know a better term for it. But I definitely recognize a lot of skepticism from people in my practice. I'm part of an organization called Ampton. Before opening up my practice, I've screened, done health talks, done lots of stuff all over the country, and doing the exact same things in my area. It just doesn't necessarily have the same results. And it's not an excuse or anything like that. I'm not trying to. That's not what the point of this is. The point is that that's part of the reason why I'm so passionate about research. Oftentimes, I'll have somebody who philosophically, I just know that they're going to do better. We're just going to remove the interference and their body is going to heal and improve and function. And just telling them that, right? Explaining how the nervous system works just isn't enough. I get a lot of those research questions all the time. Well, do you have data to support this, blah, blah, blah. And sometimes I'll just tell people, shut up. It doesn't matter. Give it 2 months, right? Give it a little bit of time, see how your body does. It doesn't matter what research there or not. It just matters if you improve. And that's really what it comes down to. But oftentimes what I do find is that after somebody starts care, because let's be real, guys, I want to be 100% honest with you. Research isn't going to convince somebody whether or not to start care in your office. Your confidence, your certainty is what's going to be convince somebody to start care in your office or come in the first place. But oftentimes what I'll have is somebody start care and just being like, I'm seeing such amazing changes in me. I want to be able to explain it to my friends, so I need to know more, which is fine. A good example is I have somebody who just started care last month, and this is just something, everybody has those stories that's been on their hearts. This guy is like ex-football player, military, FBI, like crazy. Let's just say he's beaten the crap out of himself for years. This guy's a dad, and he's had just immense, not necessarily headaches or migraines. I mean, those are sometimes, but the best way you can describe it is he feels like this whooshing, like almost like a fluid flow up in his brain that's just constantly, he just feels it up there. He's like a whoosh is how he describes it, that he just feels that all the time. I mean, I couldn't imagine living that way. And this guy's tried everything. I mean, he's done other chiropractic care that was just like your kind of flying 7, acupuncture, everything. I mean, we all have these stories, so I'm not trying to, toot our own horn or anything like that, but the guy finally just said, hey, what is there to lose? A couple $100, a little bit of time, right? What if it does work? What do I have to gain? And that's what it comes down to. That's kind of the way that we talked to him about it. Your body's going to heal, and that's it. And he's seen such ridiculously amazing results. He's like, I need to understand what's actually happening in me. So immediately, when I hear about this whooshing thing, I think about the Damadian research, hemodynamics of the craniocervical junction, the upright MRI study. We've spoken about this before. We've broken this down before. So that's, if you guys don't know all about that, please go look at the past stuff, or just search on the ChiroEdge blog. I think it should be for anything Raymond Damadian, looking at the upright MRI research that looks at past cervical whiplash, past cervical trauma relating to pathogenesis of MS because of increased fluid flow up in the brain. So I immediately started thinking about that. It's like 30 pages of research, and I was like, hey man, like I gave him the patient newsletters for this that we had, and he was like, this is awesome, I love this, I gotta know more. And I gave him the actual research, and he sat down and he figured it out and he read it. He was just came to me in tears, and he was like, I could have been a member of this study. This is me. And he's taken that, and he's taken our patient newsletters in the office, and he's given it to, distributed to his old football coaches. He's distributed to the different society for head and neck trauma that he's a part of, because he just knows that if these are the results that he's seen for him, there's just so much more out there. So if you guys are listening, obviously not if you are, since you are listening to this podcast, just know I'm not trying to give you crap to go talk, like I'm not trying to say go deliver this research and just start talking about research all the time in your office. No, that's not what wins hearts and minds. They just want to know that you know, right? You should be taking up-to-date, current, relevant research and breaking or whatever and breaking it down to patient newsletters. You should have a constant drip of information on your practice members, and that's what ChiroEdge is there for. You should have it be accurate as well. Part of the reason we started the company in the first place is because I got tired of hearing people say that chiropractic boosts immunity by 400%, because that's just a made-up number, right? And we hear made-up numbers and statistics in chiropractic all the time, and it makes me cringe. But you should have a constant drip of education on, because you never know who it's going to touch. You never know how it's going to inspire them. And you never know how that's going to get distributed to people who need hope. So that's the point of this research breakdown. I just wanted to thank you guys so much since you are listening to this. I just want to be honest with you. And I just wanted to thank you for listening. And the reason I want to thank you for listening, because you're listening to a podcast called the Chiropractic Research Breakdown. And I named it that specifically for a reason, because I don't want it to be some clickbait, right? I want people to listen to this who care about science, who care about chiropractic, who care so much that they're not just going to go spew bull results out there. They're going to use actual research. So since you're listening to this, it means by definition that you must care, because you're listening to a podcast with the most boring title out there. And all we do is talk about and break down not only chiropractic, but medical, but pharmaceutical research, and how it applies to how the body should function, and how that applies to chiropractic care and what you should be delivering to their community. So thank you for caring. Because whether it shows up yesterday or showed up yesterday, whether it's going to show up today or whether it's going to show up tomorrow, your community is going to know that you are the person who goes above and beyond and cares about delivering the highest quality of care. And if you care about delivering the highest quality of care, they are going to do better. So thank you. And without further ado, let's jump into this week's content. Now, I've been really excited to do this next paper for a little bit because I've actually had this and been reading it for about 2-3 weeks, really trying to pull out what I wanted to talk about with it, because there's so much and we could go so deep into it. But I just wanted to just highlight it. Now, anyway, it's called the Kaleidoscope Model of Integrative Healthcare as a Collaborative Paradigm for Cardiology and Chiropractic, a Call to Action. Now, this is published in Integrative Medicine Research, and it's written by Drs. Daniel Cohen, a chiropractor, Dr. Charles S. Masarsky, a chiropractor, Marian Todres Masarsky, a chiropractor, and the Masarskys have written a book that I want to read called, where the heck is it? somatovisceral aspects of chiropractic and evidence-based approach, which is really cool. And the last author on this paper is Dr. Stephen Schulman from Johns Hopkins, who's a cardiologist, who's actually was the physician of the year in 2015. Now, in these paper, these four have boldly, I believe, written this amazing review discussing how chiropractic and cardiology should work hand in hand, and have actually introduced steps in order to incorporate chiropractic into the management of cardiovascular disease in a hospital setting. It's a phenomenal paper. So I really recommend reading it. Once again, it's called The Kaleidoscope Model of Integrative Healthcare as a Collaborative Paradigm for Cardiology and Chiropractic, a Call to Action. So heart disease is the leading cause of death in the U.S. and costs more than $200 billion a year. They say while ongoing treatments currently involve lifestyle changes, lifestyle changes, medicines, medical surgical procedures, and cardiac rehabilitation, this situation clearly calls for any plausible avenue providing improvement. So what they're doing is they're going ahead and they're talking about why chiropractic should be included in the management. The viability, they break this into different sections. First is introduction. Second is the historical and contemporary models of the medical chiropractic collaboration. They talk about things like the Clearview Sanitarium. Then they talk about the viability. Why is this important? Well, chiropractic has documented overall low safety risks. Chiropractic as a profession clearly documents overall cost effectiveness and high patient satisfaction. Low back pain. While low back pain is not a primary focus of cardiology, cardiac rehabilitation is relevant to inevitable step-down scenarios provided within the Kaleidoscope Model settings, among others. Now, they go ahead and define this Kaleidoscope Model as doctors of chiropractic and medical doctors working as synergistic co-providers rather than just subordinates. So their interaction, or they recommend, first off, prior interactions between the two professions, communicating their differences in depth. And I'm going through this because I think that if you are to refer with or work with any medical providers in your area, we certainly receive a lot of PT, OT, referrals, ophthalmologist referrals, just simply because of how we are, the way that we communicate, and actually understanding the science. People appreciate that. But what we do is whenever we meet with somebody, we definitely say, this is where we draw the line, and this is where you are, this is where we are, and this is what we do. So we definitely want to communicate our similarities and differences beforehand, and that's their first recommendation. They want to ample opportunity through direct contact to find purposivism with research, basically where do we align. And the two professions earnestly strive to extract all possible tools and benefits available, leaning toward meaningful results. Now, my exciting part is when they talk about the physiology, the basis of how chiropractic can help. Now, they mention that the vagus nerve exits the skull at the jugular foramen in close proximity to the atlanto-occipital joint, which we talk about all the time. Therefore, any correction of that subluxation in that area or cranial dysfunction may assist the body in regulating the heart's parasympathetic tone. Amazing. Parasympathetic tone. If you look at it, sympathetic tone is what increases heart rate. Parasympathetic tone is what decreases. So next is that there's preganglionic fibers that synapse at the superior cervical, middle cervical, and stellate ganglia. Therefore, correction of cervical and or thoracic subluxation can help regulate sympathetic heart and the great vessels, sympathetic tone of the heart and great vessels. Additionally, sympathetic innervations go to the smooth muscle within the tunica media, and therefore influence elastability and compliance of the arterial vessels. Greater compliance allows for greater increase or decrease of blood pressure when appropriate. They go into previous research. Now, they mentioned some case studies. We've talked about a lot of those, so I'm not going to go into it. But they measure a couple studies of people with they were all pilot studies, so people with hypertension. 6 chiropractic students with blood pressures of at least 140/90 received chiropractic adjustments for correction of dysfunctional occipitomastoid suture mechanics. They saw an average of 10 millimeters of mercury decrease in the systolic blood pressure. In another pilot, 21 patients with hypertension were randomly assigned to active treatment. Active treatment subjects were adjusted between T1 to T5. Both systolic and diastolic blood pressures decreased. Awesome. So they propose how to implement, and they give a couple different steps. Step 1, to the maximum degree possible, hospital rounds and patient consultations will involve both medical and chiropractic practitioners. 2, medical and chiropractic practitioners will have frequent opportunities to observe each other's procedures. 3, continuing education and training will involve both professions whenever practical. 4, consistent with diligent medical oversight, the patient will determine the combinations of disciplines as applied to various stages of care. I'm going to repeat that. The patient will determine the combinations of disciplines as applied to various stages of care. 5, medical and chiropractic practitioners will participate in developing research protocols. 6, the Kaleidoscope Model will initially operate within the cardiology division of a major teaching hospital. So the reason I bring this up, it's not original research, it's just an opinion paper. But if you're still in your practice talking about how medicine is just simply the devil, I think you're missing out on some huge opportunities in the future. And while that may be serving your practice now, while fear is a huge motivating factor, I think that with especially the more conscious millennial generation that's coming up that isn't as fear-based but is more looking to be inspired, where, YOLO and FOMO, you only live once, and fear of missing out are prevalent. I think remaining in a fear-based model of if you take drugs, you will die. If you listen to your medical doctors, you will die. I think that that's outdated, or will be outdated soon. And while it is important, while Big Pharma is responsible for huge evils, and while it is something that we can communicate with all the time, I mean, you hear me talk about things like C-sections all the time, I think that there's going to be a shift in the future that really, I want to see more chiropractors really start to embrace the fact that, hey, emergency medicine is there for a reason. It's there for a reason. And this is what we do as well, right? And say last resort, not first option, because a lot of people will spew the last resort, not first option rhetoric. And what I mean by that is saying, medicine is always there. It's there as a last resort, not a first option. First option should be, lifestyle and chiropractic. But then they go and they say, if you take drugs for any reason, you're awful. Like you're just falling into big pharma conspiracy. Whatever, right? I mean, you can have your opinions on that. We can certainly talk about that at length, but I'm not going to, because that's not the point of this. What I see the future of our profession is a little bit more of a collaborative effort, where chiropractic is more of a first resort and is just utilized more for people with or without symptoms, with or without issues. And I just want to see more of this collaborative effort between MDs and chiropractors. And the number one thing that starts with that is understanding. I mean, you hear them talk about in this model about sitting down, having conversations, going over differences, doing research together, going over research, all of these different things. One thing that's hugely important is that chiropractic, and I just want you to leave you with this, is that chiropractic care is awesome because chiropractic care is awesome. Chiropractic care is not awesome because medicine is bad. It's just awesome because it's awesome. And if your whole justification for why chiropractic is great is because medicine is awful and this is an alternative, I don't care how successful your practice is right now. I think that overall you're doing your community a disservice. And I'm going to leave you with that. Thank you. Okay, this next study we're going to look at is called Influence of Spinal Manipulation on Autonomic Modulation and Heart Rate in Patients with Rotator Cuff Tendinopathy. This is a paper that is actually written by physical therapists on spinal manipulation for joint dysfunction. And they're looking at how, believe it or not, spinal manipulation for joint dysfunction, right, not subluxation, may influence the autonomic nervous system. Who would have thought? There's a couple issues with this, though. We're going to go into it. All right. They looked at how spinal manipulation of the fourth and fifth thoracic vertebra can be used has been used as a conservative treatment for shoulder pain, and it's helped with people with rotator cuff tendinopathy. The reason being is that the motion of the shoulder and the position of the thoracic spine are so intricately related that an issue with one is going to cause dysfunction of the other. So if there's a shoulder issue, it's going to cause back dysfunction, and if there's back dysfunction, it's going to cause a shoulder issue. And that's their theory here. They also look at how autonomic nervous system activity, which can be monitored via HRV, is altered in individuals who are experiencing pain, specifically the neck, the mid-back, and the low back. And they wanted to see if there was altered function in individuals who have shoulder pain due to these rotator cuff tendinopathies. So they took 90 people, they split them into 3 groups. One people had this spinal manipulation and they didn't have rotator cuff problems. One had rotator cuff problems and had spinal manipulation, and one had rotator cuff problems and they weren't manipulated at all. The funny thing here, and this is just crazy as a chiropractor, as somebody who's specific and scientific with all of my adjustments, all they did for every person is they just moved, just with a cross piezoform, diversified adjustment, if you know what that is. They just moved the 4th and 5th thoracic vertebra. There's no mention in their methods of any sort of analysis, feeling to see if it's even dysfunctional or if there's joint problems or anything. We're just going to press on it, right? Talk about non-specific techniques. I mean, it just breaks my heart to hear that this is what they're doing. Of course. All right, whatever. So just slamming on, not even, it's one thing to slam on the high spots. They're not even slamming on the high spots. They're just slamming. Crazy. So they did this. What they found was that for both the placebo group and for the spinal manipulation group, they saw improvements in parasympathetic activity, increase in parasympathetic activity, which is funny because you would think that thoracic spine is sympathetic, but they did see an increase in parasympathetic activity, even though it's the thoracic region, and their mind was boggled by this. So it must be because of the shoulder pain that there's an increase of parasympathetic activity there. There's nothing really significant that they found other than the fact that the autonomic nervous system changed just simply by touching this area for somebody who's in pain. But for us, this is really important because we know that specific adjustments of the spine do influence autonomic nervous system activity. And while they didn't compare specific to manipulation, while they didn't compare adjustment to manipulation, we know that the adjustment improves this. They're showing that the manipulation, does, but it's not really statistically significant. So this really brings up a good point for us, because you will go out go on your Facebook and you'll hear jabroni chiropractors talk about how there's no difference between manipulation or adjustment. You'll hear some of the major researchers in chiropractic calling adjustment manipulation, saying, we just want to get it in the literature. But here's the thing, is it's not the same flippin' thing. It's not the same thing. Manipulations and adjustments are not the same thing. Clearly, as you can tell by the fact that they didn't see statistical significant change in autonomic nervous system activity with the spinal manipulation, because it's not the same thing, because there's zero analysis whatsoever. So when you hear a teacher, a professor, a researcher stand and look you straight in the face and say, hey, the reason we didn't use the word subluxation, the reason we didn't use the word adjustment is because science doesn't care and we just wanted to get in this journal, they're dumb. They're not dumb. They're really smart. They're probably smarter than me. But I just think that they're missing the whole flipping point. Because we can go there and say, look at these amazing heart rate variability changes that happen with adjustments and call it spinal manipulation. And then all of a sudden the physical therapists are going to go, oh, well, we're doing a spinal manipulation too. Well, why didn't we get these results? And then they're going to try to disprove all of our research. It's absurd to me. It's absurd to me that we're still having this conversation. This is the reason that I use the word subluxation. This is the reason I use the word adjustment. This is the reason I don't use manipulation. This is the reason I don't use joint dysfunction. This paper right here. Yeah. Oh, I'm just kind of looking at it again. It's all talking about physical therapists. Would you like to know what school, what university this came from. National University of Health Sciences. I don't even think there's not even a DC on this paper. It's just physical therapists. Anyway. National. I'll go ahead and say it. You guys are stupid. Somebody get some sense over there. All right, I'm done with this paper. We're going to move on. All right, guys. The last article that I want to go over with you today is called Immediate Influence of Lumbar Spine Manipulation on Pain, Functional Reach, Static Balance, and Walking Gait Kinematics of Individuals with Acute Low Back Pain. Now, first off, I wanted to apologize if the audio on this portion is a little weird. I'm actually in my car. I got a couple minutes before a meeting, so it's hot as heck. The AC's on, and that might be any distortion in the background, so just bear with me on this. Anyway, this research was done at Texas Chiropractic College and is published in the Chiropractic Journal of Australia. So that should have given me indication as to how weird this article is and how much I wasn't going to like it, although it does have good things taken away. Anyway, the purpose was to assess the immediate impact of lumbar spine manipulation on pain, on functional reach, on static balance, and on walking gait kinematics on individuals with acute low back pain. Now, I thought that this was just Chiropractic Journal of Australia, and because that's pretty good a lot of the times with subluxation. I thought when they were just using spinal manipulation here and publishing spinal manipulation here, that it's going to be one of those, hey, we're doing, joint manipulation, spinal manipulation because of joint dysfunction, and not like the last article that we spoke about, which was just a general manipulation with no analysis whatsoever. But oh, how quickly I was let down. 68 participants with low back pain had all this baseline testing, and they had lumbar spinal manipulative therapy bilaterally at L3 in an attempt to impact most of the lumbar spine. That is just such bull. I'm just tired. I'm tired of this. Come on. At L3, every single person that walks in is going to need to be adjusted at L3. It's not adjusted, manipulated at L3 because it's in the middle of the spine? Are you freaking nuts? It's like if you get any results from this at all, kudos. But this isn't a chiropractic. Why is it published in the Chiropractic Journal of Australia? It's chiropractors who are doing the research, but they're researching physical therapy. This would be like chiropractors publishing research on e-stim. There's chiropractors who use e-stim, but it's not chiropractic. All right, I'll stop yelling now. It really bothers me. Anyway, they did all this testing. They did testing with pain, functional reach, step length, a bunch of other stuff. They have two groups. They have a control group, which received no manipulation, and they received this spinal manipulative therapy, which is spinal manipulative therapy as another group. There was no placebo, which is like a fake adjustment, so they didn't get the control for that. Although they mentioned that they should have done a placebo, which is an activator on a 0 setting, which, if you're actually able to assess for subluxation, you can, use an activator and integrator on a 0 setting, and it could still clear it if you have functional indicators to make sure it's actually clear. But, who am I? So anyway, they side postured on both sides of... it pains me to say this. They side postured on both sides of L3 because you know what? It's not about actually correcting anything, it's just about moving it. Side postured on both sides. What they saw was that their pain decreased right away and that their step length increased. And they think that the gain and here we go. This is them, right? In a discussion. The gain in function may be associated with the decrease of pain due to the spinal manipulative therapy. Basically saying that the only reason they're writing this, right, in words of why they think the step length increased. The only reason why there was actually an increase in function is because we had less pain, right? Instead of being like, well, chiropractic is actually intended not to treat pain, but to increase function. So they're just totally backwards. Journal from Texas, published in Australia. Everyone's freaking confused. Last line of the paper. This research project was supported by a grant from NCMEC. So, if you have nitpick for your malpractice, this is what they consider to be chiropractic. I can't really go too much into this because I did a lot of yelling on this episode of the podcast. Anyway, chiropractic is not about manipulating a joint for no reason. It is about analyzing, delivering pinpoint-specific adjustments to correct vertebral subluxation, which is misalignments of the spine that cause interference and disruption in the nervous system. There's no reason that's the exact reason that their step length improved, but none of the other variables that they were looking at improved, which is stride length, standing on one leg, ankle function, knee function, everything. So, that's it for me. This episode, we can make this into like semi-chiropractic. I don't know. That's it for me this episode, guys. As always, you can get chiropractic information boiled down, put in your inbox every week at chiroedgemedia.com. I apologize for the uninspiring message today. Although some of the research we used was absolutely amazing, the thing is we have to call a spade, and we have to call bull out when it's wrong. Part of the reasons that this podcast exists at all, part of the reason that ChiroEdge exists at all is because we got tired of people making claims that don't actually matter or don't actually exist, right? Like making claims about science that doesn't actually exist. So it's equally responsible for us to call out and give you good science as to tell you when it's bad. Because when we go out there and we start talking about studies like this, when we have people talk about studies like this, we need to demand from our experts, we need to demand from our researchers, putting our actual money, the money for chiropractors, towards chiropractic. So if you support any of these organizations that support this, rethink it. I promise next week we're going to be a little more inspiring and give you some more positive information. Anyway, Dr. Anthony Pellegrino from ChiroEdge, I'm signing off. Catch you all next week.